Well, hello and welcome inside the State Champs Sports Network podcast room as we take a few minutes to address lacrosse-specific injuries in general. Today, we're being joined by Dr. John Morasso, a sports medicine physician at the Detroit Medical Center. Thank you so much for joining me today.
Happy to be here. Thanks for having me.
All right, it's always great to talk to you, and for those of you out there, you should know that Dr. Morasso specializes in non-operative holistic care for persons of all ages and activity levels, so not just athletes. So if your parents need a quick look, he'll take care of you too. Hey, we all know lacrosse is exciting, fast-paced, but obviously the combination of the quick changes of direction, the contact that's involved in the game, the ball, a very hard ball, by the way, traveling at very high speeds, provides a great environment for injuries. Now, given the physical demands of the sport, what are some of the most common lacrosse injuries that you may come across?
So with lacrosse, we do see wide gamut of injuries. These can include soft tissue injuries like lacerations. That's where you get a break in the skin. They can be contusions, which is a bruise, and this can be of the soft tissue, the muscles. It can also be a bruise of the bone. We see sprains, which are injuries to the ligaments, a stretch injury to a ligament. We also see strains, and this is where we get an issue with the muscle. And within that, we also see fractures. We see overuse injuries like tendonitis. And in our younger athletes, we'll see things like Osgood Schlatter's and Sievers, which is where the growth plate gets irritated. So we really will see it all in lacrosse.
Wow, it runs the gamut. So we're always talking about how to treat injuries after they happen, but what are some tried and true methods that high school athletes can do to really try and help prevent injuries in general?
So the biggest thing we can do to prevent injuries happens long before the game. So this occurs even in the preseason, in the off season, when we're getting ready to be able to compete. So making sure that we're in good top shape, endurance-wise, coming into the season, making sure that we're really doing dynamic stretching and getting these muscles and tendons and ligaments warmed up before we're exploding into those explosive cuts is very important. Hydration and nutrition aren't talked about enough. Very important as far as preventing soft tissue injuries and keeping us hydrated and moving the way that our bodies are supposed to.
You know, I love the fact that you specialize in non-operative solutions to injuries. And I think sometimes, they feel that they might just be, that may be the only option. But what are some non-surgical treatments the DMC offers to treat sports lacrosse injuries and others?
Yeah, I'm glad you mentioned that, Lauren, because almost 90% of all sports injuries are treated non-operatively. So with that comes there's a lot of different options of things that we can do to help this out. So one of the main things that I do and that some of my colleagues here do, we do a lot of osteopathic manipulation or OMT. This is a hands-on approach to try to get the structures of the body functioning and working better. When structurally things are in better alignment and moving better, they're going to function better. So that's something that we can do to treat acute injuries and also to help with long-standing issues, with alignment issues. We utilize our physical therapy. We have a really great physical therapy and rehab department with athletic trainers and physical therapists. And, so we utilize those tools as well. We have myofascial work and things that we can do with acupuncture and injection options. We use ultrasound to help get the correct diagnosis in real time, right at the time of care. And then, there's a whole lot of other things you can do as far as topical medications, things that can just help get you feeling better and also get you stronger so that you're able to recover and compete at your best.
You've kind of already alluded to it, but just like lacrosse players have to work as a team, you also work with a team of healthcare professionals to make sure your patients get the best care. Tell us about the team the athletes with sports injuries have access to at the DMC.
Yeah, absolutely. So even aside from I just mentioned like our physical therapy team and our athletic trainers, we have performance specialists who can work on very specific sport-specific activities. We utilize home exercise programs. We have nutritionists. We have therapists and counselors. Important to focus on mental health aspect of an athlete. And then we also utilize our surgical colleagues as well when that's appropriate. We have It's also very important to get the correct diagnosis. So we work very closely with our radiologists to make sure that we're getting the best reads that we can, because we need those answers to help us guide our treatment. So just like lacrosse, like you said, is a team sport. We really treat our patients as a team, and even other non-operative sports docs who have the same degrees that I have, we all specialize in different things. So we can utilize each other, and we refer patients to each other when there's someone who has some additional training or expertise in one particular area. We make sure we get them in the right hands.
Right on. It's always the age-old question. I think parents want to know it. When should someone see a sports medicine physician? Because sometimes they can be on the fence and think it will just all work out.
Yeah. So a lot of this is going to go off of really intuition. The student athlete will typically know, but also it's very important that they're not just pushing through pain, because a lot of times if we keep pushing through pain, we can actually make a small problem a lot worse, and we really want to try to avoid ever needing surgery or anything more invasive. So if you're ever on the fence, I think it's always good to just get a recommendation. Specifically with a sports medicine specialist, I think there's a lot of fear coming to the doctor that, oh, they're just going to shut me down, or they're going to tell me I can't do something for 6 to 8 weeks. Where really, like, our goal, what we did all this extra training for, is to help determine what the problem is. Is this something that we can play through? Is this something that we can just manage the symptoms? Or is this something we need to address a muscle imbalance, or figure out more of a root cause of the issue? So always getting an assessment isn't going to hurt, and can just help give you some additional information. And just remember, our goal is to get you back. Our goal is your goal. So if your goal is to get back, we want to be able to allow you to do that as soon as possible. And we keep into different times of the season, make things different as we're getting towards the playoffs. If it's the last game of the last game of your career, there's going to be different options than if you're a freshman in the off season and we have some time to work through things.
Got it. Got it. Well, that's great. The DMC is the official healthcare provider for the Detroit Red Wings. And if you have a sports injury, go where the pros go. The orthopedic and sports medicine team at the Detroit Medical Center. To learn more, visit dmc.org/sports or call 1-888-300-DOCS. Dr. John Morasso, thank you so much, sir.
Thank you. Great having you.
Right.
Or great having you. Great being on.
You got it.